The Government of Alberta's Ministry of Health supports community programs throughout Alberta that promote wellness. Examples of 3 initiatives currently being implemented are Communities ChooseWell, Mental Health Capacity Building, and MEND programs.
The Communities ChooseWell initiative, we really focus in on communities, in particular empowering, supporting, and recognizing communities for their efforts in promoting healthy eating and active living. Since inception in 2005, over 250 communities in Alberta have registered to eat right and be active. I think ChooseWell really does bring together the recreation and park sector and brings it together with the health sector, the two work together to really create community wellness.
The ChooseWell program for our community was an opportunity to showcase fitness, health, our facilities, our green spaces. It was an opportunity for our residents to get active and participate not only as individuals but more as families. The green spaces allows a lot of spontaneous use, and so how do we initiate that, and how do we get our community members back into the community, back into our parks? And so that's what we saw it as. The Iron Chef competition was an exciting initiative set off by ChooseWell. When we read about it, it was just, again, incorporating food. So we held the competition within our youth program, and from that, Cole was our nominee towards it. I think what was nice for us was we didn't look at the Iron Chef as an adults competition. We truly focused on it as a youth program. How do we get youth looking at food in a more creative, not even healthy way, but how do we bring them back to the table?
I'm Cole Dribnenky, the 2011 ChooseWell Iron Chef. The ChooseWell Iron Chef competition is for young cooks to learn how to make healthy food. Okay, before I learned how to eat healthy, I would eat a lot of junk food and everything, but now I would rather eat a cucumber or something. I've transferred some of what I learned in the competition to helping my family with cooking at home a lot more, and my parents really appreciate it and they say, good job.
The ChooseWell program has benefited me personally by allowing me to have a place and many opportunities to involve my family with my active lifestyle.
To me, it means a lot of things. It's a nudge, for instance, in promoting community wellness through active living and healthy eating. For me, it's also an accessible initiative that has a lot of meaning for communities when they think of the provincial nature, and that they're all working together to help create a healthier Alberta.
The Way In is an initiative between 3 junior high schools and various partners to support the health and mental health for students and families that attend those schools. Schools are the hub of their community. They're a natural gateway for students and their families. Students and their families feel comfortable, and the teachers within those schools have really good relationships with their students and with the families. It's important that we address mental health at a very young age. We know that 1 in 5 students is going to be impacted in a significant way by a mental health issue. If we can provide supports early, and if we can provide wraparound supports for our kids, they're going to do much better throughout the rest of their lives. What's so important about The Way In is the support that we're able to offer to the kids that we see. We can meet the basic needs of students, whether it's bus passes or lunches. We're able to make sure that kids have coats and boots and everything that they need to be successful. We're able to hook our kids in with mentors or with success coaches who can support their daily needs at school, at the same time as they're being supported with mental health issues and academic concerns. We are very resiliency-based. We work on building assets in our kids. What's a kid good at? What are you already doing well? And we work from that principle. And our kids have shown an improvement in attendance, their reduction in suspensions, and overall, they're more resilient kids. They're making better choices.
The mission of MEND is really to have parents and kids to learn how to eat better and be more active. The long-term goal is that they're fitter, healthier, and happier. What we know is that if we don't start intervening earlier or sooner, that the rate of obesity will continue to increase in Alberta and across Canada. So MEND is really giving the tools to impact families, to make healthier changes and hopefully decrease or at least keep the level of obesity in Alberta the same. MEND has multiple components in that it stands for mind, exercise, nutrition, and do it. Kids are taught how to have healthier nutrition, be more active, and to make behavior changes. The Alberta Nutrition Guidelines were really used as the foundation for the adaptation for the MEND program here in Alberta. The MEND program in Alberta was first piloted here in Calgary, and now it's actually available in 8 communities across Alberta.
The MEND program has helped Anisha in a very good way. Now, before she's eating, she's thinking what she's eating.
They put SMART goals, like they have like a nutrition goal and an exercise goal. This program is really fun because at the end of all of the sessions, we always go to exercise, and it's really fun because we're playing games. We're not running laps the whole entire time, and like we match up with our friends and stuff, and like I bring that home so everyone else can have fun too.
The whole family, I think the changes has to start with us in order to get the kids to eat healthy and stuff like that. So if my husband and I know about it, then we can bring the healthier food in the house, and that's why the whole family is eating healthier. So I think that's a big thing, that the whole family is joining the MEND program. The family is eating healthy. We are being more active. The family is more closer because we are spending more time together. I mean, what else can I ask for?
I'm proudest of the families and the dedication that the families come. 10 weeks is a long time, so the fact that they come twice a week for 10 weeks to make those changes, and they come in with enthusiasm and dedication, that's truly what I'm proudest of, is the families. Mind. Exercise. Nutrition. Do it.